Welcome back to Beyond Four Walls, Conversations on Affordable Housing. I'm David Dworkin, President and CEO of the National Housing Conference, the nation's oldest and broadest affordable housing coalition. I'm joined today by Joseph Becerra, a true pioneer and leader on the front lines of the fight to end homelessness. I had the privilege of spending a day with him and his street medicine team in Los Angeles last month. Joseph is the original community health worker and co-founder of USC Street Medicine, where he now serves as supervising CHW. He has dedicated his life to changing the lives of the underserved, incarcerated, and at-risk youth as a certified addiction treatment counselor, certified clinical supervisor, and certified gang interventionist. Joseph has worked with the Department of Mental Health in the juvenile justice system, supported studies on intravenous drug use at USC, and helped develop youth programs, homes for children, methadone clinics, needle exchanges, and human trafficking prevention efforts. As Vice President of Rolling Revival Relief, he also brings support and disaster relief to Native American reservations and communities across the United States. In 2022, Joseph was named to the Clinician Steering Committee for the National Health Care for the Homeless Council, where he now travels the country, sharing his story and expertise to advance healthcare and support for unsheltered populations. Welcome, Joseph. I'm so excited to talk with you today.
Good morning. How are you doing today?
Great. So we had a really incredible experience for me with the street medicine team. This was a new concept to me. It makes perfect sense in retrospect. But let's start with, what is street medicine? How does USC figure into this? And what actually happens on the street? The kinds of things that we saw and the things that you do every day.
So street medicine, and the definition is basically how it sounds. It's medicine on the street. When you came out with us, Dave, you got to see some of the stuff that we do. How we work is we gather in the mornings here at the office. We just go over the daily routines of what's going on. Weekly, and then what we do is we break up into our teams. We go through our list and see who we're going to see for the day, what patients we're going to see for the day. So as we go through our list, we already know because they've already been scheduled prior. So we schedule our patients prior, like a clinic or a hospital would do. We go by how sick they are, right? So when we get out in our teams, we go out, and our teams are usually made up of a community health worker, which is the guide of the streets, and a provider, a nurse. So we usually have geographical areas that we go into in Los Angeles. We usually have a community health worker and an RN, and a community health worker and a provider. We have two different teams, and then we have so many different visitors. We have medical students, we have residents, we have visitors as yourself that come out and see what we do daily. And then we hit the streets. We hit the streets and we see our patients we are one of the premier backpack. So we do 100% backpack medicine, meaning that we don't go in a mobile unit. As you see, we're just in trucks, and we go out and we have all our meds, our wound care stuff, and everything else in backpacks. We throw them on our backs and we go to the patient no matter where they're at. If they're in mountains, if they're in oceans, if they're in deserts, if they're under bridges, Los Angeles is more concrete, so we don't do a lot of that in the downtown areas. But we go out to the patients no matter where they're at, and we help them with whatever needs they have. We do wound care, we do medicine management, we do ultrasounds, we do everything you can do that you don't need a brick and mortar for. And of course, all the specialties. We have specialty programs like HIV, we have psych, we have social work. We just started an OB, which is women's health for pregnant women on the streets. So we just basically go out to them and help them with whatever they need. And if they need other services, we send them to the hospital or the clinic, and we'll also go with them. We also have an ECM program, which is the enhanced care management, that also will go with them to the hospital, go with them to their appointments. We help them get their social security cards, we help them get benefits, we help them get food, we help them get water. We have a lot of connections for housing. We don't do housing ourselves, but we also do have a lot of connections for housing, so we also get them inside when we can. So in a nutshell, it's kind of what we do on a daily basis. I mean, there's a whole lot of what we do on a daily basis, but yeah.
It's a lot. So let me start with the appointment itself. I mean, How do people set up appointments, or how do you know that you need to see somebody on a given day? I mean, that's so out of context for me. You call the doctor, you set up an appointment, you show up. This is not that.
Yeah, when we first started the program, we started about 7 years ago now. Myself, a nurse, and our director, Brett, we basically just went to the hospital, went bedside, seen the patient like any other specialty there. They would call us. It would say, hey, there's a homeless person that has a bunch of medical needs. Can you guys come see him? We'd go bedside. We talk to them. We have something called house beds that we go through, which breaks down like, their housing, their how much food, how much, where do they sleep? Where do they use the restroom? Breaks down all that different stuff. And then we find out where they live. And then we follow them after they leave the hospital. That's how we started. And, the surprise to watch somebody that's homeless indoors see you come to the streets is pretty amazing, right? Like, what? You guys actually came? That's what you would hear like all the time. Like, I can't believe you guys actually came. Most of the people barely even come to the room to see how we're doing, but you're coming to the streets. That's how we started at the beginning. But we were just limited to county patients when we first started. So, we could be seeing a county patient and there could be somebody sick next to him, but we couldn't help them because they weren't county patients. Then we switched over to, since we're USC, we switched over to KIC. And as we switched over to KIC, we started seeing everybody.
And KIC is the medical school at the University of Southern California.
Yes, sir. Keck School of Medicine is what we're under. So how we see patients is, of course, the old-fashioned way. We get referrals. You'll get people calling you, grandma down the street will call you and say, hey, there's some guy on my street, or, a police officer, fireman, other agencies, other housing agencies, other medical agencies that don't do what we do, other just people from all over will call us and just, give us referrals. And when we get referrals, we'll see a referral within the first day or two. But a lot of times we just do outreach. So as we start a new area in Los Angeles, what we'll do is we'll just go out and see somebody on the streets. We'll pull over and, I'll just be like, hey, my name is Joseph. I work for USC Street Medicine, and this is what we do. We do medical care on the streets. If you need anything, we can help you right now. And, sometimes people look at you like, you're crazy. Like, just going to help me? Yeah, we're just going to help you. Just like that. And, you get a lot of people not wanting to, and then you get people like, oh, okay, but, a good thing is always, hey, let me check your blood pressure. Here's some water. Here's a bag of goodies, So you outreach, you talk to the people, and then as you begin, you start talking to them, you start helping them, and then they're like, hey, you think I'm bad? You should see the guy down the street. He's even worse. Or my friend that's on the other side of town, or this person or that person. And the next thing you know, you went from seeing one person to seeing 20 people around that neighborhood, like within a day or two. So, I mean, it's not hard, especially you came to Los Angeles a couple weeks ago, last week, and you've seen the homeless here on the streets. They're everywhere.
Yeah.
So you can't go at least parts of Los Angeles towards the city without seeing somebody on the streets. So that's not the hard part.
What's the hard part?
The hardest part is just the way the system works, right? So if, everybody's sick on the street, when you need the specialty care and trying to get them into the hospital, trying to get them into the clinic, we got a good relationship with LA General. So a lot of times we can make phone calls and get people in there, bypassing the emergency protocol, which is, if you've ever been to emergency here in Los Angeles, I've heard people wait 48 hours to be seen.
Wow.
In Los Angeles, yeah. So 24 hours, 15 hours. That's the biggest deterrent of people going to the emergency. Nobody wants to go to the emergency, especially because the homeless, they tend to leave all their stuff on the streets. And when they leave it, somebody will come through it, steal it. Sanitation will come through and dispose of it. Just, so much. To us, they might have nothing but trash or nothing, but to them, it's their world, so it's really hard to get them to the hospital. So, I mean, the system is broken completely. We all know this, right? So I think that's the hardest part, is getting them help if they have something really seriously going on.
So I want to dive into some of the more complex and controversial policy questions around this, but just to set a foundation, KEC has 5 medical teams. They treated over 1,000 patients in 2024, and the program has resulted in a 75% reduction in hospital admissions and reduced the length of stay from 12 to under 8 days. And of those who were treated, 42% are housed within a year. That is a lot of information. Let's pull some of that out. The hospital admissions, I mean, basically the clinic, that without you, the emergency room becomes. Is that fair to say? That people use the ER in the way that
Yeah.
most of us would use a regular doctor's appointment or going to a local clinic.
Yeah, many people don't have a primary care, doctor,
Mm-hmm.
especially on the streets. On the streets, so here's the thing. On the streets, if you got insurance, you have an insurance card, it's getting mailed
Mm-hmm.
somewhere. What address is it
Right.
getting mailed to, for one? So you don't know what primary care you have. Who's your doctor? You don't
Mm-hmm.
know. The crazy thing about it is that doctor don't know you. You don't know that doctor, but that doctor's getting paid for you being assigned to their clinic. So they're getting money regardless if they see you or not.
Really?
Yeah. So that's where the consult service was a really good thing, because most of them are like frequent flyers, right? They come back to the ED emergency room department. They come back and they utilize that as their primary doctors. But the problem is they're not taking care of the problem. They're just taking care of the issue at the moment.
Right. And I'm assuming that must increase the waiting time for everybody at the emergency room.
Oh, definitely.
You've reduced the hospital admissions. You've reduced the length of stay when people are admitted. One of the things I found really interesting is that of those you treat, 42% are housed within a year. Talk to me a little bit about why that is the case and how that actually kind of plays out with someone who you would meet with, and then 6 months later, they got housing.
We have some pretty good relationships with people that do a lot of the housing. So again, broken system. Here in Los Angeles, you have to go through something called a matching program, right? It's insane. There's LASA. We've all heard of LASA. They're the ones
No, not everybody has it. What's LASA?
It's the housing. It's like the housing management. I even forget what it stands for.
Okay.
LA housing. Yeah, authority.
Yeah.
So
Okay.
what happens is you have to go through them in order to get what's called matched.
Mm-hmm.
So matched is, homeless and sick and all these other stuff that are against you, right? The problem is with matching can take anywhere from, I've seen people get matched in a day. I've seen people get matched in a year and a half, 2 years. So you tell me, if you're homeless and live on the corner, I'm just saying the street, Main and Second, are you going to stay there for a year, 2 years in that same place? So finally, when you get matched, I have to come to you and find you and say, hey, you're matched. And the matching only lasts like 24 hours or 48 hours. I don't even know the time, but it's really, really short amount of time. So the matching system is so broken. That whole system is broken. The whole system of housing people. I remember 10 years ago, I used to be able to pick up the phone and be like, hey, I got this person. Do you have a bed? Yeah, bring them in.
Yeah.
And then when they handed over the housing part to, I don't know, the state, the county, the whoever is in charge now, it's become a whole matching program. Let's face it, everybody on the street's homeless. Everybody on the street is sick. The longer you're homeless, the more you're going to be sick. You're going to have a lot of things going on, right? So everybody's going to match. The problem is for some reason, some people match quicker, some people match forever. It takes forever. So we have a special relationship with, I guess, the city of Los Angeles. We're funded, or one of our biggest grants is from the city of Los Angeles. So we are able to at least talk to them and tell them they do something here called Inside Safe. So Inside Safe is a program where the city goes out and they target certain blocks. I guess that there's big encampments. I call them communities. They're big communities where people live. And they go and like a week or two before, they go and start telling them, hey, how would you like to be housed? How would you like it if you were indoors? How would you like it? They ask them a bunch of different questions. They don't tell them on this day we're going to house you. But when they come in, for a couple of weeks, they ask you, put you on a list. And then like 2 weeks later, they come in with the whole sanitation, big trash trucks, police. They come in with a bunch of different people. We're part of them as a medical staff. We come in.
I think we drove by something like that when we were outside of, I guess
I don't know if it was an Inside Safe, but so they do have random sanitation sweep also. But yeah, so we will go out with them and then, we'll see the people on the streets and they'll start being just, buses will come and they'll get sent to a hotel.
Mm-hmm.
So we're able to put a lot of our patients also on these lists that are in the areas that are being part of the Inside Safe, which we usually have a lot of patients there. And if we have a person that's in real need, we make some phone calls and we tend to be able to get them put in also.
So there's a lot of controversy right now about President Trump's call for clearing the streets of homeless people and moving them into facilities and requiring mental health treatment. Are you seeing that on the street now? I know the National Guard was sent to Los Angeles. And what are you seeing happening? Is it effective? What's happening in LA? And how does that relate to programs like Inside Safe that already existed?
Good question, all of them.
Yeah.
So, I mean, where do you want me to start? You asked me like a couple different
Well,
ones.
yeah.
The National Guard was a certain response to a certain thing. I don't think it was part of really, it was more for the immigration
Okay.
versus the homeless. When the National Guard came in, it was more for the immigration. That didn't have nothing to do with anybody on the street.
And homeless encampments, the clearance of that's been going on, was that started by the governor or the mayor?
That was probably mayor and city that
Mm-hmm.
go through and clean the areas and get it, I don't know, get it ready maybe,
Yeah.
Olympics, you got World Cup, you got everything coming. So what the president has said hasn't really took effect yet here.
Yeah.
I don't know if it's going to. I don't know when it's about to really hit, if it does, it's a lot of pushback.
Yeah.
But there's encampments that do get clear. There's not only Inside Safe, there's a couple of other programs that they do and just come and clear them out. Before COVID, I remember that would happen all the time. They would just come post signs on your
Mm-hmm.
block, like we're coming tomorrow, or we're coming the next day, or 3 days from now, and we're gonna come and just throw everything away. And they do. A lot of times they started doing that.
And that is some of what we saw with dumpsters. And why would you do that? I guess this first question. And why is it necessary if it is? And what is the impact that it has? Does it just move folks around? What are we getting for the money we spend doing that?
Why is it important? I mean, it matters who you ask, right?
Yeah.
It matters who you ask. I understand the why sometimes.
Mm-hmm.
One thing that we always tend to tell our patients, or in the communities that we go to, the encampments, is to really try to clean your area and keep it as tidy as possible.
Mm-hmm.
The less you have, the less you will be messed with. The more you have, and
Mm-hmm.
unfortunately, there's a lot of people who don't understand that part. The more you have, the more it gets crowded, the more you can't walk on the sidewalks, the more it becomes dangerous, the more it just becomes piled up, and it's harder to navigate, I guess you can say. And it becomes an eyesore too to some, right? So that's why I said it matters who you ask.
Mm-hmm.
You can go from one person to 30 people. The one person wasn't really making much of a difference, so there wasn't no need to clean. But once you start getting 30 or 40 people in one area, or just 10 to 15, it matters again where you're at, near schools, near homes, near places, parks, and we've seen parks being taken over. So there's some necessity to some areas, I assume. And yes, it does disrupt because you do start moving people and then you can't find people. And that becomes hard for any team. It becomes hard for us too, especially those that are really sick when they get moved like that, because we can't find them for a little while. I mean, we've lost people for months. We've lost people for a couple of years sometimes, and then they pop up again. But one thing what we do is we always try to figure out, we're creatures of habit, right? All of us. You do the same thing mostly every day. I do the same thing mostly every day. People on the street do the same thing. Just because they're on the streets don't mean that their habits change. It just becomes a different
Mm-hmm.
habit. So daily routines, as where you go and eat, where you go to shop, where do you go to friends, where do you go to get high, where do you go to drink, where do you go to, so that's stuff that we try to find out. What are your parents' names? What are your family's names? Are you in contact with them? So that way, when these big disruptions of sanitation or whatever we call it comes and moves them, we can try to find them easier, or have contacts or ways to find them. So we get as much information as possible when we see each patient, or find a patient, or talk to a patient.
The humanity of what I experienced and saw, the kindness and the patience and the care that Dr. Knopp, who was there with you and the other nurses on the team, it was just inspiring. It's almost hard to fathom. Most people walk past somebody who's living on the street and their focus is not making eye contact and just to keep going. It's painful to actually interact with somebody as a human when they're in the position they're in. And, what I got to see with you all was, I think that was one of the most inspiring things, was the intimacy of the eye contact, how humanizing it was, and how it must feel for the individual who's experiencing that living on the street. It was really powerful. It really moved me. And it's something that I think, and I know that personally, and in a way that most of us don't have a clue. Tell me a little bit about that, because you really do have experience on both sides of that relationship, don't you?
Yeah, I was homeless for probably about 13 years. You know, basically being born into homelessness, couch surfing, moving from place to place, car to car, wherever you could lay your head as a family. That's a big thing now. It seemed like back then, long time ago, right? It was easier to help families get out of these situations. That's one of the worst things now is families is like the last thing they help. You can help a single person get inside within an hour sometimes, where a family, they're on the streets for 3 or 4 years before they get help. And it's heartbreaking because if it wasn't for the family gathering back then the way it was, I'd probably still be on the streets. I mean, I was homeless as a kid growing up. We ended up in a big facility of families, right? Off the street. We were eating and sleeping. And like I said, anywhere we could, you'd get clothes, get food, get shelter wherever you could. And then we ended up going to this place in Ontario, California. It was actually, I remember the name of it was called Straight Ahead. And it always just reminded me of like the Shining, the hotel in The Shining. It was just a
Yeah.
big, giant place with, I mean, yeah, maybe I was a kid, but it seemed like 500 families. They had like a mess hall where people would eat breakfast, lunch, and dinner, and there was just kids and families all over the place. But my point to that is they actually helped families. They helped families back then get out of their situations and to help build themselves. And, it's basically what happened. They helped us. I don't know how long we were there. It seemed like years, but I don't think it was years, probably like a year or two maybe. And it helped my family get out of being homeless from sleeping in cars and stuff like that. And then later on in life, I became homeless again because of a lot of dumb decisions and choices I made. And I did live on Skid Row for a little while. And there was just many different like scenarios and stuff I could tell you that were insane. But, myself too, living in cars, I remember one time sleeping at a junior high school, asleep where they eat lunch on the tables. And then I remember waking up to a bunch of noise and it was just a bunch of kids looking at me just laying there. So, I could just imagine how a lot of the people on the streets, as you say, they pass by, but like poking you and like, it's a homeless person. And it's a lot to be on the streets and have to struggle to find where to eat, where to use the restroom, where to clean yourself up if and when. Sometimes you just give up. But just how to survive, to live and not be messed with, because you also become targets for on the street. A lot of people on the streets, as you say, people will not mess with them and just walk around them. That's mainly from being scared. But believe it or not, a lot of them just become like batting practice to some people. And it's horrible. But yeah, it's not an easy thing to get out of when you're stuck in, is being homeless. It's probably one of the hardest climbs you have to do if there's not people like us or other people helping you to get out of that hole you're in.
Help me understand. And no, you talk about your family. Who was it that was housed in that facility, the family facility that you talked about? Was it your mom and your dad, or?
At that time it was mom, dad, and a little brother. Yeah.
And how did you all graduate out of that into stable housing?
That part I don't remember. I was young. I was
Yeah.
probably 5, 6 years old, maybe
Uh-huh.
10. I can't remember the age, but I do remember leaving that place, going a few more blocks, and there was a house. I don't know, maybe it was given to us, maybe it
Yeah.
was transitional. I do remember having a house like a few blocks away. It wasn't a big house. It was like a one-bedroom house,
Mm-hmm.
but it was a house of our own. And I remember father, mother, and brother were
Yeah.
just in this place being, leaving a shelter type of facility. And as a kid, you also love that shelter type of facility because there's a bunch of other kids.
Yeah,
So,
right.
you're kind of leaving family to go to a little
Mm-hmm.
place, but it's beneficial for families And believe it or not, there is a lot of families on the street, a lot.
Yeah. So skip forward now and you end up becoming homeless yourself. And I think this is really valuable for people who are trying to understand this. How do you end up becoming homeless? What is that like? And you talked a little bit about this, but it's as though the longer you're homeless, the harder it is to get out. And what's going on with that? Help me understand that.
So right now what we see is there's a big trend, and it's understandable, right? I mean, especially here in California, our government here is just pricing us out.
Hmm.
Right? So it becomes easy. It becomes easier now, especially in a place like California, to become homeless. I mean,
Yeah.
we're all one decision, one choice, one mistake, one accident, 1 second away from being homeless. Everybody is
Hmm.
here really in LA. I mean, in the world possibly, but here in Los Angeles, because the price of living is so high, the price of groceries, the price of gas, the price of electricity, the price of just breathing here. We have a tax just to breathe here. So we see a lot of, even as we get older, I'm 54 years old. I get injured right now where I can't do a lot of what I used to. I'm in danger of losing my job, right? I lose my job, then what? I lose my
Yeah.
house, I lose my car, I lose, you lose everything because you cannot afford to live on disability. You can't afford to live on government assistance. You work all your damn life and then you turn around and they slap you in the face and say, oh, sorry, we can't help you. Here's $1,800 a month or whatever they want to give you, right? I see a big trend with a lot of people who are helping family members in that same situation. Let's say I'm taking care of my mom. She's older. I have to
Hmm.
basically quit my job to take care of her full time. I'm getting paid for it as a caregiver. You don't get paid a lot, but you stay with them, you help them. They pass away. I've seen this a lot.
Yeah.
And now what? You haven't worked in 2 years, 3 years because you were taking care of a parent or a family member. Now you're screwed. Now you're homeless because you can't afford the rent that they were in. It wasn't under your name anyway, so now you got to go. We see a lot of things that happen, from injuries to helping a family member to losing a job to wherever it may be, from house to car. Then what happens, because you're
Hmm.
still gotta look for work, your car, you can't pay your tags no more. You don't got gas money. So what happens is they'll come along, tow your car because you don't have tags. You don't have insurance.
Hmm.
It's been parked in the same place for 3 weeks because you don't have gas money. So now you lose the only form of housing that you had left was your vehicle, and now you're on the streets. So now you got to pick a curb, a sidewalk, a bench, a bus stop, wherever you can lay your head. And that's a big part of what I'm seeing, the trend. It's like a new homeless now that you see. Was Trust me, I've met doctors, I've met lawyers, I've met people that have had great professions, nurses, I mean, teachers, everybody on the street. At first, you're like, oh, okay, yeah, sure you were. But the more you talk to them, we met Little Richie's bodyguard on the street.
Hmm.
Little Richard's bodyguard was on the street, and it was interesting. And we didn't believe him. Of course, yeah, you're a Little Richard's
Hmm.
bodyguard. We finally got a hold of his mother, and she was like, "Oh yeah, he was a bodyguard for Little Richard for many years." And it's just insane how easy it is to become homeless. But when you're homeless, it becomes even harder to get out of homelessness because, again, you don't have anything now. You don't have anything. And basically, almost your self-respect and your self-worth is almost gone when you're in the streets,
Yeah.
right?
It's a change in thinking. I mean, I was during the financial crisis, I was unemployed for 3 years. And I have to say that every year it was a different emotional and mental experience. And I definitely understood how people could get trapped in that. And when I went back to work, I realized, yeah, I had to relearn a lot of things.
It's definitely eye-opening when you have to humble yourself, especially as a man. Men, we're not taught to, we're taught to be the providers, caregivers. You gotta, help your family and do this other stuff. And then when you don't have anything, it's like, oh my God, like,
Yeah.
you lose, like I said, everything, your self-worth, your who you are as a person, what you mean to, and then basically you start soaking in that and you're just on the streets, right? I mean, think about it. Women on the streets are 100% victims.
Yeah.
They're 100% victims. They're going to get raped, robbed, beat. Men are victims on the street. They're like 80%. They're going to get the same: rape, rob, beat. So women, what they tend to do is they tend to just find themselves somebody for protection. Or a lot of times what we
Uh-huh.
tend to see, and we've talked to a lot of women on the streets, is they'll urinate and feces on themselves so they won't get attacked.
Mm.
You see them like that a lot of the times, and
Mhm.
it's a self-defense more than it is a mental issue or a just not caring issue. But then what happens, the more you start doing that to yourself, you become that. Your mind, you start, losing your mind and stuff like that.
So what happened with you? How did you get out?
It's a good question. I think not giving up. I mean, really
Mhm.
just I can go into a bunch of stuff. I sold drugs. I did all this other
Mhm.
stuff all my life. And those are like some of the mistakes that I made. I said the
Yeah.
choices that I made, right? But sometimes, you got to do what you got to do sometimes. And it's sad to say. And I worked myself up by just hustling and selling just
Mhm.
different stuff. And did it involve stealing and robbing and stuff like that? And some of it probably did. You know, Again, when nobody helps you, you got to help yourself sometimes. And nowadays it's a little bit easier because you got
Mm.
people like us to help you. Back then, there wasn't a lot of choices. Believe it or not, I put myself in like a men's home, and
Mhm.
that kind of like changed my perspective of a lot of stuff. It was a Christian men's home. It helped me to understand, and they helped. They helped a lot. And it made me think about, I was at a point where I was like, I can't do anything. I don't have no skill. I'm not a doctor. I can't design anything. The only thing I can do is really count grams, ounces, and pounds because that's all I've ever done.
Mhm.
Even as a kid, that's
Mhm.
all I did. Even as a kid, I was survival with my father, and everybody else was, my father was like, hey, you need lunch money? Here's a nickel bag. Go sell it and get you $5.
Mhm.
So it
Mhm.
was embedded in me. So I thought the only thing I could do was, hey, let me just go to school and become a drug and alcohol counselor. So that's basically how I built myself up. I utilized the housing that I had from the men's home and the help that I had, and a little bit of government assistance, went back to school and was able to, really do what I knew. And that's kind of where I'm at right now, right? Is doing what I know.
Well, and there's a unique credibility when you talk to somebody to say, "Yeah, I know," and you really do know.
100% on the streets, they know that already about you. You know what I mean? That's why with USC, all we do is hire people with lived experience because
Mm.
we go to places where other people can't go. We go to certain areas where they know if you're full of crap or not.
Yeah, I think it's a survival skill to know.
Yeah.
So, what should we be thinking here in Washington? How do we make a difference? What are we doing wrong? What do you need to help make some of these changes stick? You're intervening with people, you're giving them a leg up. There's a lot of recidivism. People end up back on the street. The system in LA, as you said, is very broken, but it's broken all over the country. What are we doing wrong? People are saying, well, we need to take people and put them into facilities against their will, whether they want to or not. We need to, if you're not willing to take shelter, you should be arrested. And that just seems on every level misdirected. Economically, it's ridiculous because it's so much more expensive. At the same time, I have friends who were homeless and got sober and clean and turned their life around because of the direct threat of incarceration. I mean, it was that or get clean, and they were like, all right, fine, I'll get clean. And so it's a double edged sword. But how would you recommend we start thinking about this? Because on the one hand, we've got to cut off the pipeline. We need more affordable housing. If we keep feeding that pipeline with people who can't have housing, we're never going to catch up. But to help move people off the street, what do they need and what do you need to help them?
I think you and I had this little conversation, right, about it.
Hmm.
I do believe that housing is big. It is a big thing. Do I believe it's the end all? I don't believe it's the end all. I'm not a big housing first person.
Hmm.
I'm a person first person. Get the person what they need. Housing's a great opportunity because not only does it give you a different perspective on yourself, because now you can take showers, you have a place to lay your head where you're safe. You have light, water, you have a refrigerator, most of the time you'll be able to put food in there or they'll bring you food. But I think the disservice in most of these putting somebody inside is all you're doing is putting somebody from the outside inside and you haven't done nothing else, right? So awesome. We're inside. We're safe now. But you're not equipping them to do something else in life. In other words, to me, I think a lot of these programs, what they're really missing is training them to do something, training them to be a different person. Like you said, when you went back, you had to retrain yourself. We do have to retrain ourselves. We have to train ourselves, and it matters, the longer you've been on the streets, most of it's survival at that point. Turn that survivalist into somebody that can be an electrician. Turn him into somebody that can be a plumber. Turn him into somebody that can, do data entry. Like, we need more of these programs set up to help people achieve something else in life, because help's only for a little while. Utilize this help. Help them understand that utilizing this help to build themselves and to help themselves go forward is, to me, the biggest thing. And I mean, the government has to step the hell back and help us be able to live. Because how are people supposed to live when they can't even afford? I mean, a burger used to be $1. It was probably the worst burger, and that's why people were fat. I mean, myself included. But, it's $10 now for a dang burger. It's like, if you're in California, it's like outrageous. I mean, it's $7 some places for gas. It's insane. So I think we really need to help people. You can put somebody on drugs outside and put them inside. They're not going to stop using drugs. They just got a place to use drugs. We need to help them understand that using drugs is bad, yes, but it's also not helping them. Get them help to do that too. We need help to help them stop using. We need help to help them go forward, not only with if they're drug users. Not everybody on the streets are drug users. That's a myth. But we need to equip people with a better way to help their own mentalities grow.
Yeah. And we're so bad at accounting. I mean, when you look at what it costs to help somebody to provide that kind of support, and you compare it to the cost in lost income taxes when they get on their feet, in the cost of incarceration when they get arrested, in the cost of emergency care when they get sick, it's so much cheaper to help them the right way than to do nothing. And I think we just don't get that.
I think one of the biggest problems too, and I know I'll probably get slapped or shot for saying this, but I think legalizing, or maybe not legalizing, but allowing people just to use drugs and just say it's okay. You know what I mean? Before, like you said, you had friends. That's what happened to me. I was looking at 22 to Life one time, and that's what shook my world up, and that's why I put myself in a men's home, and that's why I did all that. Jail, of course, is not the answer, and I'm not saying take people to jail, but take people to treatment. Help people help themselves. And for those that can't help themselves, help them. Because I think the moment we started slapping people in the hands for little offenses, they're little offenses, I get it. Drugs, what are you doing? You're really just hurting yourself. But hurting yourself, you're hurting generations, you're hurting the economy, you're hurting the world, because people are walking and stepping in stuff and seeing people. I mean, do I agree with putting people in jail? No, but I do agree with somebody having to have consequences in order to change, because without some type of consequences, and I'm not saying bad consequences, just consequences, period. A lot of times we don't think about it or care about it. I just think, again, equipping people with ways to be better, trainings and sobriety, mental health institutions, are they good? No. But are they bad? No. I mean, there's a middle line for everything.
Yeah, that's my thing with housing first. If you're in a position where you just need housing, then it's not housing first, it's housing only. You need housing now, and we need to give you housing. If you're in a situation where you have a drug addiction problem or mental health issues, we need to treat that. And housing often comes with that. Just putting you in an apartment somewhere and saying good luck, even though you intend to help them, but you don't have the money, so nothing happens, that just seems cruel.
I agree. I 100% agree on that. I mean, like I told you one time, we had a patient that we actually put inside, but she had so much anxiety, she didn't sleep inside. She had slept in a tent downstairs from her apartment. She just kept it inside for storage. So we didn't meet that underlying issue
Right.
of what was going on with her. Yeah, she was better off living in the apartment, but if she stood downstairs, she just used it for storage. I get it, it's safety, but still, you're still sleeping on the street.
Yeah. It's very complicated, and I think policymakers hate complicated. If it doesn't boil down to a talking point, people just can't hold it. And it's unfortunate because if we're going to fix this, we're going to have to do it the same way we got into it, which is a lot of different things all coming together.
Yeah, I mean, you put a bunch of people who use drugs in a facility where they can just use drugs. I mean, what did you just do? You just made a drug facility. I mean, how about putting somebody that's in there helping them not do those drugs in those facilities,
Yeah, and there are places like that, and they're expensive, but you get what you pay for.
Right. All right.
So one of the things I always ask my guests is, tell me something about yourself that has nothing to do with your work that's really interesting. That's a hard question for you because, frankly, everything I know about you is really interesting. It's you, so for you, it may not feel that way, but tell me something that has nothing to do with your work that is really interesting.
You had asked me that question, or you had told me that, and I'm one of those people that I can give you 500 bad things about me. I can do that, no problem, and run them off. But the good things is hard for me to do. But I think the thing that I can say the most is, I'm a grandfather, take care of my grandkids, basically almost a father again because I have them all the time and they're always with me. And I get them up every morning. Like this morning, had to make them their sandwiches and get their clothes on and, a little bit of breakfast and get them ready and put them in the car, get them to school. And then from school, come straight to work. So, I mean, I think as we get older, I always joke around and say, yeah, I hate my kids, but I love my grandkids. Everybody's always like, oh, the good thing they love about the grandkids, they can give them back. I don't want to give mine back. If it wasn't for my grandkids, who the hell know where I'd be? You know what I mean? They help me more than I help them. I do everything for them. We do the sports, we do baseball, my grandson, dance for my granddaughter. Like we do so much different stuff that if it wasn't for my grandkids, that I certainly would still be in the streets, not giving a dang about life. That's my biggest thing.
I love it. I can't think of a better way to both end the conversation and begin the rest of our day. Thank you. Thank you for listening to this edition of Beyond Four Walls. You can visit the National Housing Conference at nhc.org. There you can learn more about affordable housing policies, affordability challenges throughout the nation on our Paycheck to Paycheck database, and explore membership in NHC for you or your organization. We appreciate your interest and look forward to working with you in the future. Until next time, I'm David Dworkin, NHC's President and CEO, wishing you a great day.